Yeah, you're a good boy.
On this episode of Bondi Vet, Scott's regal patient has a concerning lump.
Bye-bye, my sausage, I love you.
Even the possibility that Cleo might be looking at cancer, it's heartbreaking.
I don't want this to be like the last time I see her.
Hi, I'm Chris.
Good. Oh, hi, Chris.
Reporting for duty.
Chris heads for the hills
It's on her offside shoulder.
That's nasty.
and treats a shocking wound on his first day as a country vet.
I've got no doubt that if I was to do nothing here, then Sparkles would develop a major infection. This can kill him.
I always get worried when koalas are out. I mean, we got dingoes here, devils there.
And the curious case of the missing koala.
Haven't seen anyone about this big, fluffy, black nose? I hope not. Where are you, buddy? Come on, there's your girl. You're home to become a star.
Oh, right.
In Isleworth, Kiati is bringing her pride and joy, 12-year-old Bombay cat Cleo, to see Scott.
Good girl. You be brave for mummy. When we first got her, we were trying to think what kind of name would we give her, and people thought she was very regal and she walks with her tail in the air. She had a very Egyptian feel about her with her pointy ears, and we thought Cleopatra is really fitting. You'll be home soon, and we'll have lots of treats when you get back.
Hi, Kiati, how are you?
Hi. I'm
Good
thank
morning.
you. Good morning.
Hi, Cleo. It's a fancy box. Or should I say chariot? You all right? She looks like a princess there, doesn't she? Sort of resplendent in her beautiful bed. Come on then, gorgeous. I'll take the princess, shall I? Come on in. It is very clear from Kiati just how much Cleo means to her. She's such a much-loved cat and she's so besotted. She's almost obsessed, but in a good way. And remind me, how old is Cleo again?
She's 12.
She's 12. Princess in the family for 12 years.
Yes. Whatever she wants, she gets. She's very fussy.
Are you sort of the servant at home,
Oh
are
yes,
you?
oh yes. We are just her humble servants.
I love this as well. Look at it. Look, like she's got me
Yeah.
working as
Oh,
well.
yeah.
I will stay here as long as you do something for me. Can I look at your mouth if I do this all day? Hey? Kiati's brought Cleo to see me today because she has a lump over her canine tooth. Kiati is obviously very anxious. This is the lump that we're concerned about here. So you think she just seems more comfortable after the antibiotics?
I think it's definitely gone down. It was very swollen.
Good.
But obviously it's still there, you see.
Yeah, very much still there. Whenever as vets we see lumps in the mouth, it can either be something completely benign or really something quite horrifically malignant. There really is never any middle ground. I'm hopeful that it might be a fractured canine that has got an infection and it's big and swollen and angry. And hopefully we may see a root there and we can remove that and we won't find that there's any cancer. The worst case scenario is that this could be a malignant form of oral cancer, and when that's present it grows quickly, it's painful, and unfortunately it does end up taking their life. And unfortunately, if we are dealing with something significant, then as a family you'll have to make the decision, do you want to go to that next step? But fingers crossed that's not where we have to go.
Yeah. We're not going to put her through any trauma if we don't have to.
Yeah.
We'd rather that she was comfortable and continues to be spoilt until the end.
Yes, well I can see that that's going to happen. So what we're going to do with you today is Uncle Scott is going to take some blood from you first. So we're going to do that just to make sure that we're aware of the risks before we put her under anaesthetics. Again, an older girl.
So it's the first time that she's ever kind of going under anaesthetic. She's not a young cat, and actually at 12 it's a little bit worrying. I know the risks associated with the anaesthetic. I mean, are they usually okay though?
Yeah. We do anaesthetics all the time, so we're used to managing issues, even with 12-year-olds, yes. Cleo's a very old girl, and so of course I am concerned about the anaesthetic, so I've got two worries today: what lurks in her mouth and how she responds to the anaesthetic drugs. Right, well you're going to have to leave your little princess with me. She'll have her chariot with her at all times. Do you want to say goodbye to Mummy?
Bye-bye, my sausage, I love you. I love you. you, darling. I'll see you soon, okay? You be brave for Mummy. Thank you very much.
You're welcome.
Look after my baby.
I will. Bye.
Bye-bye. Bye, darling. I love you. I'm bracing myself. I don't want this to be like the last time I see her. You know, be hoping to bring her home and then for some reason I don't.
Kiati has a really close bond with this cat. You can see it, it's palpable. Even the possibility that Cleo might be looking at cancer, it's heartbreaking. Hey Jason, how you doing? So this is Cleo. She is a bit of a princess. You can see she's in her chariot. Even got a personalised, so she's a VIP. Lovely Royal Elizabethan collar. Wow, it looks great against your black coat. Look at that. I think Mummy would approve.
First step is to test Cleo's blood to see if it's too risky for the 12-year-old to undergo a general anaesthetic.
Oh, good girl. That's lovely, thank you. Just taking a sample of blood and we're going to run that through our machine, and that just tells us what her liver and her kidneys are up to, just to make sure that she's perfectly healthy, so when it comes to anaesthetic there's no surprises. So Cleo's blood's all absolutely fine, no cause for concern, so we can move straight on with the anaesthetic. So this is what we're dealing with, Jason. So we're going to x-ray her head and just see if I can see if there's a root there, but also we're just going to be checking the bone and just see if there's any degeneration to suggest that there might be a tumour that's eating away at the bone. Okay, sleepy time now. Just a little cat nap. So it's a few minutes and then we'll go for it.
Despite blood tests giving her the all clear, Cleo is reacting badly to the anaesthetic.
Just as we induce Cleo, she stops breathing. You just get some adrenaline. Yeah, 0.1. Whilst Cleo is not breathing, we're not breathing. A lot of patients go into some level of respiratory depression, but hers keeps going and keeps going. Adrenaline's flowing and we just really need Cleo to start breathing again. There's one. Okay. Smell like it. Cleo. That was a little bit longer than I would have liked. So thankfully, when she does take that first breath of air, everyone breathes a sigh of relief, but I just know that Kiatin would be having kittens if she knew her precious girl decided not to breathe. Still breathing all right? Yep, good.
With Cleo now stable, the crucial x-rays of the worrying lump in Cleo's mouth can finally be taken.
Okay, x-ray. Basically we've shot down through Cleo's head and you can see the canine there on the left-hand side, but on the right-hand side where there's this big bulge, there isn't that same density. So it's not clearly a tooth root, unfortunately, which is a shame because at least that would show us why there's that swelling.
The x-ray images are inconclusive. Scott will now surgically investigate the problem area.
Still breathing okay? Yeah. So I'm just going to go in and see if there's any remnants of the root from whenever this tooth has been lost. The tricky bit with doing this procedure is just how far into the upper jaw you have to go to retrieve any degenerate bone. And one false move, you can be going straight towards the cat's eye and also its brain. So you have to be quite careful. On opening up the oral lump, there is a lot of old broken down bone. So I'm hopeful that this is an inflammatory condition, but it still could be cancer. Now I've scraped it out, I can then feel healthy bone around the outside. You know, I'm hopeful that this might end up turning out okay. Fingers crossed.
But Scott can't be sure until a tissue sample from Cleo's lump is analysed.
We'll send it off to the lab and they'll let me know if there's any cancer cells or anything that I should be worried about. So Cleo's mum's got a little bit of an agonising wait. Right, let's go. Come on then.
I think I've been kind of anxious. I think this is the worst bit, when you just wait to be with her afterwards and see what the problem actually was and, you know, what she's going to be like, and hoping she's you know, not in too much pain.
And here's your beautiful girl.
Oh, hello, my darling.
Here's mummy.
Oh, hello.
Here we go. Big cuddles.
Oh, hello, my sausage. Oh, my little baby. Hello, my love.
So she's been very good.
Hello, my lovey.
From the x-ray we could see the upper jaw looks nice and healthy, but there was that major swelling around that site. So there is some degenerate bone present within that, which I've been able to remove. I've got some samples, which we're going to send off to the lab just to be 100% sure that we're not looking at anything too sinister. But one thing I should let you know, when we actually went to perform the anaesthetic, she did stop breathing for a long time. So it was a bit nerve-wracking.
Yeah.
So we gave her a little bit of adrenaline just to pick her back up again, and thankfully she did start breathing.
Getting through the anaesthetic bit feels, and the fact that she did kind of stop breathing kind of makes you think your worry isn't unnecessary. So I'm just glad she made it through.
All right, there we go. You're so welcome.
Thank you ever so much.
Bye, gorgeous. All right, we'll see you later. So now it's all about a waiting game. It's waiting for those test results to come back from the lab. She is one of our royal clients, and hopefully her reign will continue for many years to come.
Mummy, come here. Come and sit here.
A week later, Kiati is waiting for Scott to arrive with news of Cleo's test results.
Good girl. Good girl.
The first part of putting Cleo through anaesthetic and feeling like, okay, that's one hurdle. I think the next one has been waiting for the results.
Hello. Hi, Kiati. How are you?
I'm okay, thank you. Do come in.
Oh, thank you so much. Where's the Queen? It's a pleasure to see Cleo resplendent in her palace. It's always nice to get invited to the Queen's house. Oral tumours can be one of two things, either completely benign or dreadfully malignant. And the news is good that it's come back as a benign type of tumour.
Oh, that's wonderful.
It's called a peripheral odontogenic fibroma.
Not cancerous.
It's not.
I can't tell you how relieved I am. I know she's getting a bit older, but I think for a moment there I thought, wow, is this it? And yeah, I'm just really glad. I'm really glad. Looks like we have some more time to make lots of memories. Really, really good news, especially because I know that the outcome could have been very different. So yeah, I feel really lucky.
Good girl. We'll go out in a minute.
Something not a lot of people know is that when I was at uni, my dream was always to work with the big stuff, horses, cows and sheep. But when I graduated, something happened. I ended up working in the city, so that dream was never ever realised. But this week, a mate of mine, Andrew Jackatine, has asked me to help him out in his country vet practice. So this is my big chance to put those skills to the test and see if I ever could have made it. This could be interesting.
Hello.
Hi, how you going today?
How you going? I'm Chris.
Good. Oh, hi, Chris.
Reporting for duty.
Oh.
Hello.
you
Hello,
going?
Good to see you.
Long time no see.
Mate, nice place you got here.
Like it?
It's all right. It looks massive.
The Mansfield Veterinary Clinic looks after the Victorian High Country. It's a busy practice.
But we've got some work on. Thought you might send you straight out on the job.
What is it?
Well, it's a horse with a cut shoulder.
Give it a go.
We'll give you the tour of duty later.
I'm lucky about. The one thing that's predictable about horses is they're unpredictable. This horse could be an absolute little pony, or it could be a wild kicking machine. You only know once you get there.
Oh, Chris,
Hey, how you going?
you're a long way from home.
Yeah.
How you
How you
doing?
going? You're Claire?
Good.
How are you?
Good, thank you.
So where's our horse?
It's just down here.
Okay. What's her name?
Sparkles. It's on her offside shoulder.
What Chris is about to see is a lot more serious than he expected.
Rumi. It looks terrible. It's worse than what I thought it was. Rumi.
That's nasty.
Sparkles was startled by a rabbit. In her panic, she got caught up on a gate post.
This isn't just a small scratch, this is a massive open gash. I've got no doubt that if I was to do nothing here, then Sparkles would develop a major infection. And horses, they're very sensitive to infections and they can kill them. What we'll have to do is just give her a little bit of a sedation. It'll just take a few minutes just to have its full effect.
Sure.
What I'll do is just start to clean up that wound there.
No mix.
Considering what I'm trying to do to her, it's probably not a huge surprise that Sparkles tries to give me a bit of a kick.
Very good.
I just have to keep alert here because a big kick from her will hurt a lot more than a bite from any dog in the clinic back in Bondi.
Steady, steady. Whoop, whoop.
The issue I've got with any sort of wound when it's happening in the paddock like this is that you don't really know what they've cut themselves on, you don't really know how dirty the wound is, so you just assume it is dirty and just give me a really good flush because any bacteria in here, once we close it over, will just go crazy.
Sparkles has been with Claire for 19 years and taken all her children through Pony Club.
She's just like part of the family. She's a very kind and gentle horse, and you don't like to see any animal in pain, but she's certainly done a number on herself this time. Good girl. Good man. Good girl.
This isn't just a small stitch up, this is a piece of major construction because I need to bring the muscle in underneath and then the skin over the top. It's all right.
Almost done though.
The very good news for you, Sparkles, is that is me done there.
Very good.
Antibiotic and tetanus injections complete the treatment.
For a city vet, I think he's done all right. Made a neat job of it.
You happy? Are you just sleepy? You just want to sleep? Yeah, okay. Got a nod there. I didn't realise I was actually getting watched by them, but it appears the show's over. Hey, thanks for coming along. Yeah, I'll be around for a week. Thank you. Yeah, you're going to start laughing as well. How appropriate. I'm so pleased and relieved because she looks great. And this, as a recovery ward, it's all right. Day one, horse surgery, a success. Many more days to come. Many more tests to come.
Good boy.
In reception at the Bondi Referral Hospital SASH is anxious owner Catherine with 3 miniature poodles.
This here is Boots, and these are his brothers, Chopper and BJ.
But it's 2.5-year-old Boots that Catherine is worried about.
He was not very well last night, and then this afternoon when we got home I found a little lump under his neck, rolled him over, and there was quite a big looking thing.
Catherine is concerned that what she found is a deadly paralysis tick.
Come on, guys.
All 3 poodles have been together and need to be checked for the life-threatening parasite. But Boots appears to be the only dog affected.
Oh, that's a big crater. When did you first notice that something was not right with Boots?
Probably last night he was vomiting up his meals, and since then he hasn't kept anything down.
Emergency vet Lisa Chimes is convinced that the tick toxin has already begun shutting down Boots' system.
Boots is definitely showing signs of tick paralysis. His back legs have gone, he's really wobbly, he's falling all over the place, and if we don't treat him straight away, he could get worse very quickly.
He's going to need to stay in hospital. We're going to give him some sedation, clipping off all his hair to make sure there's no other ticks.
How do we check that they don't?
The only way to know for sure is to give them a haircut too.
There's always a concern that something dreadful happens and they don't make it. And then you've got to go back and tell the children.
I know, it's a little sting. Hey, brothers.
While BJ and Chopper are admitted for observation, Lisa begins life-saving treatment on Boots.
So we're just putting an IV catheter in Boots because we need to give him his tick anti-serum. We've got to get it in pretty soon because he's already got the signs of tick paralysis. He's certainly a very sick dog right now. Hey, sweet pea. You're a good boy.
Now that we've given Boots the tick anti-serum, it's really important that we take some x-rays of his chest, because what can happen with tick paralysis is it can cause their esophagus, their food pipe, to dilate, and that can make them prone to inhaling their vomit. So it's really, really important that we know what's going on. It does show that he's got a condition called mega esophagus. The tick has basically paralysed his esophagus. We don't feed Boots anything, because anything we give him by mouth is going to just come straight back up and put him at risk of pneumonia. So he's going to stay on a drip until that mega esophagus gets better, and that could take days. He can get started with his full body shave, and then we've got 2 others lined up for their shaving as well.
The miniature poodle is being shaved to ensure there are no other ticks attacking his system.
Who wants to be checked next? All right, we'll take you, BJ.
As a precaution, his brothers Chopper and BJ are also being checked to ensure they aren't carrying any of the deadly parasites.
BJ's been in the same area as Boots, so even though he seems fine now, we might still find a tick on him and he could still develop signs of tick paralysis. So we've got to keep a close eye on it.
Whoa, it feels funny, doesn't it?
All right, Chopper buddy, it's your turn. Come on.
Oh, it sounded quick.
You found another one?
Yeah, wow, it's really far in.
So while we were shaving Boots, we've just found another tick on his ear, so it goes to show how important the shaving is.
Oh, I know, it hurts. Good boy.
Okay. We got it, baby. We got it. If we hadn't found the other tick, the tick anti-serum wouldn't be working as effectively, because this tick would still be injecting toxin into Boots' system.
While Boots' siblings Chopper and BJ appear to be clear of any ticks, little Boots is struggling as the tick toxin continues to attack his system.
At the moment, we're pretty happy that Chopper and BJ are tick-free. They're not showing any signs of tick paralysis, which is great. But certainly ticks can hide anywhere, so we're going to keep checking them to make sure we haven't missed them. Boots could certainly get much worse. His breathing is already looking a lot more laboured than it was when he came in, so we have to keep a very, very close eye on him. You're okay, Boots. You're all right. To come home. All right, but your brothers are ready. They're troublemakers. We've had them in overnight, we've looked for ticks, haven't found any, which is great. So poor Boots is the one that really copped it. He had 2 ticks on him and he's really not doing that well. Say bye to Boots. Say bye, Boots. Come on, BJ. Come on, Chopper. Oh my goodness.
Oh, look at you.
Catherine and the extended family have come to take the much-loved poodles home.
Hello, Chopper.
So these guys are looking okay, but now the most important thing is all of you, especially you guys, because I bet you guys pat them the most, is to look for ticks every single day. The boys are very happy, they're feeling good, they're actually really lucky. So they're on their way home and we're still left here with Boots and hopefully we'll get him home soon too. Hey Boots! How you feeling, little boy? Oh, you're so much stronger.
Boots is finally winning the war against the deadly tick paralysis that was attacking his body.
Boots is looking fantastic. He's strong in his legs. He's breathing normally, so everything's really doing what we want it to do. And now we just need to take an x-ray to see if his dilated esophagus has improved. And if it has, then we can feed him. And if he eats normally, then he can go home. See, Boots? It's all normal. It's all gone. All better. You're a good boy. Okay, Boots. Hey, you want something to eat now, honey? Look what I got. Good boy. He's come along in leaps and bounds. He's stronger, he's feeling better, and he's actually a lot more relaxed, a lot less nervous, and I think he's really excited to go home. Let's go, Boots, come on!
Waiting in reception is Catherine and Boots' fan club. Brothers BJ and Chopper have also come along for the reunion.
so well. You never know.
Apart from the haircut.
You're so cute, Bootsy.
Bye. Good luck. All the kids and Kathy are delighted to have Boots back home. They're so excited. I think they just want to pamper him and give him lots of TLC till he gets back on his feet.
He's definitely not in there.
No, mate, I can see 3, not 4. He's supposed to be in here.
Overnight, Theo the koala has gone missing from his home at the Australian Reptile Park. General Manager Tim Faulkner is justifiably concerned.
Yeah, I got to tell you, mate, I always get worried when koalas are out. I mean, we got dingoes here, devils there. Let's have a look at this yard and then find him.
Okay, mate.
Yeah. We have 13 koalas here at the reptile park, and sometimes they go missing. They don't vanish into thin air, but perhaps a keeper leaves a hose or a rake up against the fence, and koala climbs out. Other times, they just get the desire to jump out. It's not easy, but it happens. Well, the yard's good. I mean, there's no obvious signs out, so it's something else, but you know, our priority now, we've got a koala on the loose.
Theo's on the loose.
Yep, we've got to find him.
Righto, let's get on.
Come on, Theo, where are you, mate? Where are you, buddy? I'm really worried about Theo. Koalas, when they get out, they climb up a tree in a safe spot, go up across a limb into another tree, and they can come down and be someone's lunch. Dingo yard, devil yard, alligator lagoon. We can't let that happen. We've got to find him, and fast. What are you doing up there, mate? You haven't seen anyone about this big, fluffy, black nose? I hope not. Keep looking up.
After more than an hour of searching for the elusive Theo, Tim and Mike have turned up nothing. The situation is getting desperate.
Theo, boy, Theo. What have you done?
We'll look for Theo all day if we have to. He could be up really high in a tree, covered by leaves and foliage, and simply, we can't see him. If we have to, we'll stay here at night. I really hope it doesn't come to that. Come on, Theo, where are you, mate?
Mike to Tim.
Go ahead.
I've got Theo.
Ah, you little ripper. Good on you, mate.
The good news, Mike's found Theo. The bad news is he's dangerously high up a tree and he plans to stay there.
Well, you found him. Now we've got to get him down.
The fun part.
Yeah. I don't want him to get any higher.
No, I don't want him any higher either.
Theo, no more. The plan now is just to scale the tree, try and get myself up high enough that I can then use the pole. And the pole's got a plastic bag on the end that makes a bit of noise. Now you put that above the koala's head and hopefully it makes the koala come down. I'm coming up, Theo.
That's it, mate.
Come on. Oh, he's going up.
As soon as Tim begins scaling the tree, Theo's on the run.
He's going up.
The higher Theo gets, the more risky the rescue operation becomes.
Come on, pal.
He's going even further, lovely.
I don't want to have to go to the top of that tree because it starts blowing in the wind then and it gets a bit scary. If he goes up too high, I can't follow. I have to pull back for my safety and for Theo's. If the branch gets too thin, it could bend and snap and he's going to come crashing down. No higher, Theo. Down this way, please. That's a boy.
Tim must now coax Theo down before the koala falls and injures himself.
Little bit more, buddy, that hand. Come on. Yeah, I know you're cranky, mate.
But Theo isn't interested in coming down.
Come on, Pally. Theo's a man on a mission and he doesn't want to play ball. He's putting up a fight. So I'm trying to unhook one hand while he's grabbing on with the other. He's moving around the back of the tree. Then he starts to bite. It's not easy. Come on, pal. Come on, onto me, mate. Don't forget I'm up in the tree too, buddy.
You got him?
Yep, trying to bite.
Yeah, you happy?
Yep. Settle down. Settle down. Theo's accepted that he's coming down, and once he's on me, he settles. But I've got to get the two of us down safely. Do you think you can grab him, mate?
Yeah, I can get him now.
Please, that claw out of my back.
Come on, Theo.
Thank you.
Come on, mate. Oh, geez, he's got me now. Oh. Okay, shh, it's okay.
With Theo now safe, it's time for the cheeky koala to go back to his enclosure.
Well, he knows he's home, mate. He's having a good sniff.
He does. What do you think he got out?
Well, I got a suspicion, mate. Wouldn't be the first time. I reckon he's out looking for love.
Ah, Theo. You little devil, out looking for the ladies. Tim's got a theory that Theo's gotten out because he's after a girl. Now, I'm personally happy to help out any of my little male buddies here. So, Theo, we're going to see what we can do for you.
He's been calling the whole way.
Matchmaker Tim is about to introduce the amorous Theo.
There you go, pal.
To his potential new girlfriend, Pia.
Theo is a young male, prime of his life, 3 years old, and this will be his first introduction to a female Pia. Now, he's a teenager. He got halfway here last night. That's probably what he was after, so it's a pretty exciting day. Hey, mate. Yeah. And he's been grunting, like koalas do, the whole way from the yard to here.
The only question now is, will there be koala chemistry between Theo and new mum Pia?
I'm really excited for Theo. He's shown us all the signs, we've found a perfect match, and we're about to introduce them. The only thing that I'm a little bit concerned about is little Polly. I don't think what we're about to see is something appropriate at her tender age. Good girl, come over here. You might not want to see this.
Let's go, mate. Up you go. There you go. That's Pia. Be gentle. That's good. Oh, no, he's still missing. Lift up a little. Lift her up. There we go. That's it. Good boy. Just needed a little bit of help. Excellent. Successful mating, mate.
Very successful.
She's nice and quiet too. Very easy. Perfect timing.
Oh, Polly hasn't seen a thing.
Good.
No, she hasn't seen a thing. It's okay, darling. Look at the eucalyptus trees out there.
That's it. She's finished. That was good.
That was unreal.
Excellent.
Yep.
That's the most perfect mating you could hope for. Wow, Theo. For a first mating, that was brilliant. He showed all the trademark skills that we want to see in a young adult male koala. Should be pretty impressed with himself.
The hope is Pia will fall pregnant and give birth to another little Joey in 5 weeks' time. As for Theo, he's pretty impressed with his efforts.
Go on, give us a roar. Give us a roar. Cool. Yeah, you're a good boy. You're a good boy.
Well done, mate.
What a day. Theo, he did get out, but we were able to get him back, introduce him to Pia, and I feel really good because we've been able to help them mate and start the next generation. Our little boy's a man. Theo, Theo, Theo.
Hi, I'm Dr. Kate. If you enjoyed this video, make sure you go and subscribe to the Bondi Vet YouTube channel. Click on the screen now to watch more great content. Or for new, exclusive, never seen before Bondi Vet stories, all you have to do is sign up at bondipet.com and we'll send you a link. We can't wait to see you there.